Hello and welcome to my channel for future mothers. I'm Nai, and here we explore all things from pregnancy to parenting and everything in between. Happy to have you here and really happy to dive into this conversation about the good girl. Last video, I talked about the psychological reasons that may keep women from experiencing the most that they can get from birth, or maybe experiencing what they can enjoy even from birth. For those of you that are new, I'm an ecstatic birth practitioner. I'm not a mother yet, but I am researching all things about motherhood and birth in preparation for the journey. And so in that last video, we spoke about the psychological reasons that may keep a woman from being fully connected to herself and her body while she births. And from that, I was inspired to make this video. It wasn't just that, I was also in a community of doulas, and we were having a conversation, and I noticed that when they were describing some of the issues that they were coming across from their clients, it was a tendency to want to comply to what is already being done in the hospital. So from that, I was thinking about the good girl, should I call it a complex? This thing that I think that a lot of us have been socially conditioned to be, and how that may prohibit us from really having ownership and feeling empowered during our birth. So that's why I would like this video to be about. So we're going to dive into how the pressure to be the good girl can keep women from advocating for themselves in the hospital during birth. And if you see me again looking down, it's because I have some notes and I want to make sure that I speak to certain things while we're having this chat. So you may have been told, because I know I've been told, trust the doctors, calm down, be easy, don't make a fuss. People don't like people who say things. All of these things I've heard in my life ever since I was a young kid, be nice. These messages started really young, and unfortunately, I feel like they can follow, especially women, girls and women, they can follow us throughout our lives. This expectation to always be good, be compliant, be calm, and for some reason, that's equated with being reasonable and rational. I would argue it's also reasonable and rational to sometimes be upset in an upsetting situation. You may not yell and scream at people, maybe. Um, but if it's an upsetting situation, I think it's completely normal to try to resolve it, but you might also be upset. And so I feel like sometimes that good girl expectation and complex can keep us from being fully present, but also being able to feel uncomfortable to advocate for ourselves. So let's break it down. The good girl conditioning. Where does it start? Like from childhood, many of us are taught to be agreeable, like I said before. We're taught to prioritize other people's comfort. I know that was definitely something I was socially conditioned to do. Avoid being difficult. Um, don't complain, just go with the flow, go along with everything. And we learned, not just from being told, but I think also just in experiencing people, that it's important to be liked, and being liked is more important than being heard. It's more important than being understood. I would even argue that being liked is equated to being safe. If people like you, then you're safe from people's whims, you're safe. People are more likely to do things for you because you're likable. Now let's fast forward to the birthing situation. You're in the hospital. You're surrounded by medical professionals. You feel vulnerable. You might even be scared. All the emotions that could come to being in that type of situation. And your instinct to be the good patient kicks in, which makes sense, right? You're feeling vulnerable. You want to be safe, socially conditioned, be safe. I have to be good. I have to be the good patient. I have to be compliant. I have to be easy. I can't ask people to go out of their way. This is how I'm going to be safe. So you don't want to upset the nurses. You don't want to seem demanding, and you definitely don't want the reputation to be seen as difficult. I don't know if this sounds like you. I know I've done a lot of work to try to break out of that good girl complex or the conditioning, but it kicks in sometimes because again, I connect it with just this idea of feeling safe, right? You don't want to be difficult, but according to Dr. Rachel Reed, women have been conditioned to be compliant patients rather than active participants in their own care. And this is what she wrote in Reclaiming Childbirth as a Rite of Passage in 2021. This conditioning often leads women to feel disempowered during labor and delivery, which, if I'm feeling disempowered, I'm not likely to advocate for myself. I'm not likely to advocate for what I'm feeling. And what scares me about that is I'm not advocating for my baby, for what I'm feeling and what I think that we need in order to be healthy, you know? So here's how the good girl conditioning can show up in a delivery room. You're told you have to stay in bed, even though movement could help your labor progress. And this is actually scientific. Like moving around can help your labor progress, it can help you manage some of the pain. You're feeling intense pain, but hesitate to ask for different pain management options. You don't just have to do epidural, you actually have options. You hesitate to ask for different options because you don't want to bother the nurses or you don't want to be seen as a difficult person or someone who wants extra care. A doctor suggests a medical intervention, and even though you're unsure, you just go along with it because you don't want to seem like you're questioning authority and you don't want the doctor to feel like you're disrespecting him or her and their expertise. You want to birth in a certain position. That's what feels right in your body, but the staff tells you it's easier for you to just lay on your back, which is actually not what research shows. But you comply even if it feels wrong, right? This is commonly done. It doesn't make somebody a bad person. This is what I'm saying. I think it's the good girl complex. We want to be good girls, but sometimes it has very real consequences that are not so good for us. A study published in Birth Issues and Perinatal Care in 2017 found that women who felt pressured into medical interventions that they did not feel was right for them were significantly more likely to experience some type of birth trauma. So really listening to your body is really important. And I think that doing everything that you need to do, I know I'm trying to do everything I need to do to really be more aware of how I respond to things and be aware of how the system is so that I can feel comfortable and have the right people around me where even if I have to advocate for myself, I'm going to be listened to and I'm not going to be seen as difficult because I don't think it's just us. I think it's something that's co-produced. Like some people really do see people who advocate for themselves as difficult. They just don't want to deal with them, and that's definitely what is communicated. So I think it's probably best just to have people around you or choose like to curate your own personal experience around birth so you don't have to worry about that. Because as I mentioned with the other studies, there are very real consequences to not feeling comfortable stating your discomfort during childbirth. And here are some of the consequences. When women feel like they can't speak up, they're more likely to have traumatic birth experiences. And studies show that a lack of autonomy during birth is one of the biggest contributors to birth trauma. So I'm going to say that again. Studies show that a lack of autonomy during birth, the inability to do what you feel like is right for you and feel comfortable doing that, is one of the biggest contributors to birth trauma. Not trying to scare anyone, but hey, the more we know, the better we can do. Speak up for yourself and or create an environment where we can speak up for ourselves, and it lowers the likelihood of experiencing birth trauma. Dr. Sarah Wickham notes when when women's voices are silenced in birth spaces, the likelihood of a negative or traumatic birth experiences increases. And she wrote this in Your Own Time: How Western Medicine Controls the Start of Labor and Why This Needs to Stop, published in 2018. The truth is, all of us deserve a say in our birth. And it's really important that we address some of the ways that we see things that keep us from seeing ourselves as worthy of that, of deserving of that, or even that power is something that's actually a power and not something a weight, not a weight or a burden. It's really our birthright to be able to contribute to the type of experience that we have while we're birthing our children. So, how to break free from a good girl mindset. I think for some people, this might take a variety of things, because I think being a good girl plays out in various aspects of our lives before we even get to the hospital. And so I think having awareness of it is really, really important. And not just having an awareness, but being active, right? Once I have this awareness, what am I going to do to address this? How do I create an environment around me where I feel comfortable saying no, or I don't like this, or I think this is not right for me. I think the more comfortable we get in doing that in our everyday lives, the more comfortable we are in that, in the birthing experience. So one way you can do to shift from being the good girl to being informed, confident, and vocal during your birth, is educate yourself. Know all of your options, take childbirth classes, read about interventions, understand your rights, watch the videos, listen to the podcast. Just know what you have a right to do and know what's normal for you in your body. Like, feel comfortable speaking up when something doesn't feel normal. Like, all of this is educating yourself really to validate that what you end up feeling is actually right, because you may not be validated in the hospital. And that's what I said before. It's like, it's not just, I think, us women. It's like sometimes we just live in a society that does not want to take our concerns seriously. And in the birthing space, it's just so important that it's taken seriously. So the more educated you are, the more likely you'll feel confident in advocating for yourself. Also, choose the right provider. Choose a supportive doctor, a supportive midwife, a supportive doula. Make sure your partner is on board with being supportive. I mean, I think out of all the experiences that we have as women, that this birthing experience, making sure that we are surrounded by love and just people who really want to support us and see us safe and thriving, see us and our babies safe and thriving, is so critically important during birth. I think we should have that all the time. I think it's ideal for every human to be surrounded by the people that they love. But if that's not the case, and it's not the case all the time, at the very least, when we are birthing, we should be surrounded by people who care about us, who listen to us, and at least one or two people around who just really love us. It makes a huge difference in the environment and making sure that you get the birth that you deserve. The fourth is to bring an advocate. If you're doing this in the hospital, a doula, your partner can be your advocate. Have some conversations with your partner or doula, or maybe they can do some research. And on the hospital too, I say learn the staff. Like, I would learn the staff, see what the personalities are like, who's going to be on or not, if you can. Sometimes it's not so easy to do that in certain hospitals. I get it, but just do everything you can to create like a really supportive space. And I know that that can take a lot of time, especially we have busy schedules, we have like careers and lives, and it's some things are just not so easy to do, but it really is worth it. And yeah, definitely if you can get a doula and or a partner who will advocate for you and listen to you, one of the best things you can do. And then finally, trust your instincts. If you don't trust your instincts before birth, it may be a bit difficult to do it during birth, but just practice trusting your instincts, trusting your gut. The process of birth, when I hear from doulas and women who's birthed, like I've been in this space long enough, and it is like, seems like a very instinctual space, a very primal instinctual space. And the better relationship that we have with ourselves and our instincts, the better we're able to know what's really good for us during that time and honor that space. And we have people there who also back us up and support us in our choices, even better. I think I want to end with this, and I'm also speaking to myself that asserting yourself isn't being difficult. Protecting your body, your baby, and your experience is what you get to do, especially when we live in a society that doesn't always de facto do that. Just the way systems and structures, and it's not, I don't even think it's people being intentionally unsupportive. I think it's just systems and structures in place that don't always align with what support will look like for us specifically in that moment. So assert yourself, feel comfortable asserting yourself, and protecting the space for your baby. You're powerful, you deserve respect, and you have every right to make decisions around your birth. And it's one of the most beautiful things that you're able to do. I'm talking to you, I'm talking to myself too about this, because I do think that sometimes interacting with people when you're in a very vulnerable space, it's just the idea of it just seems so overwhelming that I don't even want to think about it. But I do understand from everything I know about the research that it is important to be prepared for it, to at least have the conversation with yourself and or your partner about it and what that could look like. um, so if this resonated with you, let me know in the comments. If you've birthed and you were not the good girl, give me some tips. If you were the good girl and it worked out for you, please share your experience. Like, I just want to hear what everybody has to say about this. I think being the good girl in the birthing room and even outside of the birthing room is an ongoing sort of I don't want to say struggle, but something to consider, like especially what happens at times when you're not the good girl. So I think it really is, it could be scary, but then it also cannot be. Like, it could be just all in our heads with things, and really it's our lives, it's our bodies, it's our experiences, it's our births. And advocating for yourself, even in the face of fear, can be one of the most empowering and beautiful experiences, I think, that you can have. And I've experienced that as well. So please feel free to keep the conversation going in the comments, and please like, comment, subscribe, and share this with any mother that you think that this could be, this might serve her. All right. Until next time, take care and trust yourself, and I'll see you in the next video.